Hello everyone, I'm Dr. Vinod Babu, Consultant Diabetologist at Dr. Mohan's Diabetes Center, Indira Nagar, Bangalore. Today we are going to dedicate this live session to talk about the technological advancements which has happened in the management of diabetes in a better manner. So to talk about this, we doctors have always relied on technology when it comes to diabetes, even from the way we are diagnosing it, relying on blood tests, and these days we are using continuous glucose monitors or even insulin pumps. So we have always relied on the lab investigations for management of diabetes. And you all know diabetes is a chronic disease which requires a long-term plan for many of our patients. It's instead of a short-term plan. This is a disorder mainly of the pancreas, wherein insulin production as well as insulin utilization is the main culprit. And patients tend to have this genetically acquired in majority of the cases. So lifestyle definitely will make an impact in some manner, but again, genetic factors predominate and determine. If you manage it very well, the complication rates are very less, and if you do not manage it well, that's where the complications like damage to the eyes, kidney, heart, and liver, legs, all these things are going to come over next few decades. So how early you diagnose it is what that matters most in our country, because still we see a lot of people approaching to us very late. The first few years are very important in the course of diabetes. Body tends to remember the damage that is done during this time and then behave in that similar manner, irrespective of whether you control it in the later stages in a better manner or not. So the first 5 to 10 years are probably more important than the next 20 years. So that's how we need to identify whoever is developing diabetes, because majority of the patients do not develop any symptoms when you have diabetes. So it is your duty to check either glucometer or HbA1c, which is more accurate. Will tell you the history about the last 3 months. So how does technology play a role in identifying it early? So if you go back to 1980s or even 1950s, we didn't have these tools what we are using, HbA1c. People used to check in the urine glucose levels in order to see whether they have excess glucose. But the problem is, when the sugars are so high and it crosses the renal threshold, what we call it, then only it will appear in the urine. There were missing so many of those patients where their levels are between the renal threshold and the level where we call it as diabetes. So they were escaping the complications. So over the natural course, these tests have evolved. We have had HbA1c coming in early 90s, and then to India has been late adapter of technology when compared with the rest of the world because of the cost involved. And of course, acceptance on part of the patients also play a role in these technologies coming into the developing countries. So once HbA1c has come, it has given a single tool which will tell us what is the average of the last 3 months. That is what the HbA1c is 60 to 90 days average we get. That's a better indicator of a person's glucose control status than FPS, PPPS, or RBS, which fluctuates throughout the day, even in a normal patient. So that has revolutionized, and because of that, we have these guidelines evolving from the ADA, AAC, international organizations, or even Indian organizations like RSSDI, publish the up-to-date guidelines on a yearly basis with respect to what level of control needs to be achieved in order to prevent the complications. So that's what we adapt into our clinical practice. So then self-monitoring of blood glucose is one technology which has come, which is, glucose monitors. Glucometer is being, portable glucose meters. I still remember in my college days, my professor used to have, this was back in 2010s. One glucometer used to cost 10,000, and now the cost has come down to mere 1,000 or even 1,500 rupees. So a glucose meter has made it very handy, though we're not very accurate. One of the questions that we get is how accurate are those when it compared to your lab test? Definitely, you cannot compare apples with oranges. There is always some positive or zero error associated with it. Because the glucose meter tends to check the finger stick blood, which is the capillary blood, compared to the venous blood, what we check for the lab values. And also depends on several factors. It's like, the patient's, food that he has consumed during or before the test, and the quality of the machine, and also the glucose strips, the enzyme with which they coat that strips. If it is kept open for a long time, exposed to air and sunlight, that tends to get degraded and tends to show lower glucose values. So, though it is not a very accurate tool, but it is a very reliable tool to know where your sugars are and then make adjustments to your treatment dose by yourself instead of going to a healthcare provider. So in Mohan's, on top of that, recently we have the connected glucose meters. What is that? It is a glucometer which comes with a Bluetooth function, wherein that Bluetooth function, when you sync with the app on your phone, which is made by the respective manufacturers, it will pull all the glucose values that you have done into your app, and it will give a way for your healthcare provider. Let us say, my patient is using this glucometer. I want to see from my end how my patient is doing. I can log into my browser and then see how, if they have checked ample number of values at home before breakfast, after breakfast, before dinner, after dinner. Whether these times the patient's sugars are under control or not is what I can monitor from here. So that is the concept of connected glucose meter, so that we use it in our regular day practice. And in fact, that was one of the first things when I turn on my computer to see how my high-risk patients are doing with respect to the treatment advice I have given it last time, whether they are checking it, and if they're checking it, where are these values, what is the percentage of control that they have achieved. Anything above 70% is considered good, even in the connected glucose meter. So that is one technology we are using, which has recently come in the last 2 to 3 years. And also, one of the very important monitoring tools that we rely on these days is the connected glucose meters, which have been accepted all over the world, or used in even in a nook and corner of the world these days. These are tiny sensors, like a rupee coin device. We suggest the patients who are having high sugars, because when we prescribe a medicine to a patient, we too do not know. We have studies saying that the average HbA1c drop with this medicine is so and so, but let us say a patient comes with a HbA1c of 10 or 12, and we want to get it down to 7. We roughly, prescribe the medicine, hoping that it produces the average response that we have seen and studied. But in some people, there is always, a person who responds very well to that medicine, or a person who doesn't respond to that medicine. So, especially when your HbA1c is very high, we need to, have a better way of monitoring these complications to see what is the extent of HbA1c drop, because we don't want our sugars to be uncontrolled as well as tightly controlled, leading to high or lower sugars. Low sugars are also a very risky affair. So in order to do that, we suggest the sensors on the day when you visit and consult us. These sensors are a non-painful way of monitoring your sugars continuously, in the sense, the data that these continuous glucose monitors, or CGM devices, another name is AGP, ambulatory glucose profile. These devices will give us the data, a huge amount of data, which we can then utilize and interpret it, and then make the necessary treatment changes, mainly to see what is the impact of the treatment that I'm giving to you, and whether an additional correction or under correction or over correction is required in the treatment, is what this device will guide me. So when you wear this device, it is waterproof and you can sleep on it. The only thing is, should not remove. It basically measures the blood, interstitial fluid levels of glucose, not the blood. So it is not painful. So once you keep it on your arm or on your waist or on the back, it starts monitoring. I have had children with type 1 diabetes using it, even younger children as early as 5 years started using it. So it basically continuously checks your sugars and then stores on it, the older one. The newer sensor version will actually transmit the data to your phone or reader when you have it. If you touch your phone or reader, it will immediately show you your glucose value, instead of you actually pricking your finger and knowing your sugar value. So that is the importance. So many of our pregnant women, as well as type 1 diabetics, require multiple pricks in a day. So this is an excellent tool where they can avoid that pain 4 times a day. Usually is what we suggest in type 1 diabetes and in special categories of gestational diabetes. So these patients can totally avoid this pricking, and then they can adjust their medication of insulin or tablets according to the value shown by these continuous glucose monitors. So regarding the Freestyle Libre Pro, which we commonly use, which is the cheapest of all the devices, which works for only 14 days. There is no permanent monitoring device which we can attach to anybody. the longest that the device can work is only for 14 days. So we usually ask the patient after 14 days to come and review either telephonically or physically, and then explain this is the impact. It shows you in the chart, like from morning to evening, how your sugars have been for the all 14 days. I can even identify when you have skipped your medicine or insulin dose by looking at it. And it will also tell you at what point of the day your sugars are actually going high. That means the insulin production is less, and thereby you can avoid or make changes to your dietary plans according to that. A customized dietary plan according to your sugars. There are many patients whose sugars do not shoot up by giving the medicines. They'll always be flat. Such kind of patients do not need to go for extensive diet control or restriction of certain food items. Whereas in some people, there is usually clear pattern in morning or evening, there will be a shoot up of the sugars. So those are the times, the pancreas in such patients do not produce enough insulin, and they need to restrict the carbohydrate intake during that time. Same food, if they take it in the afternoon, that may not lead to shoot up of their sugar. So this is one easier way we can customize the diet plan according to what they are taking, depending upon the response. So these technologies have become backbone, I would say, and are here to stay. So if any of your diabetic patients are not familiar with it and have trouble getting your HbA1cs under control, I suggest you please use this technology at least once so as to be familiarized, because it is the one which is going to cure diabetes one day, someday. In fact, we have next topic of discussion which we're going to discuss. It is the insulin pumps. So we're going to discuss a little bit in that. I will tell you how this technology of continuous glucose monitoring has enabled to cure type 1 diabetes for some of the patients that we have in a sort of a pseudo cure, I would say, not like perfect, complete cure. Closest to cure what we have in type 1 diabetes is what these artificial pumps with artificial intelligence are used these days. So we have several, type of sensors. Mainly, the most popular ones are the ones made by Abbott, the Freestyle Libre Pro and Freestyle Libre, which are commonly used because they have 14 days working life cycle. And we also have some other Medtronic Jardians, and even recently I came to know that an Omnipod and even Dexcom G8 sensor was also launched in India. But those are very expensive to Indian scenario, so we have to take the decision with respect to each patient, and we have to customize it. So with that said, that is about the continuous glucose monitors we use to see what is the kind of effect that we are getting from the treatment, and then tailor make the treatment for the patients in a shortest possible of time. Usually within 2 weeks, majority of our patients, irrespective of the HbA1c, by taking this approach, by taking the detailed history and with the help of labs, getting the C-peptide done, majority of the patients are able to achieve their HbA1c targets within the 2 weeks time that we can see, and then gauge with these sensors and then make further recommendations to the treatment. Very important. Why? Because we don't know the HbA1c value until they come for next 3 months. It is an average of 3 months. So relying merely on HbA1c, causes damage. The amount of damage that a person with HbA1c of 10, takes in those 3 months, it definitely prepones the complications by few years. So that is the kind of damage we try to avoid to patients by quickly getting the sugars as soon as possible into the normal range. So the next technology that we use in our patients, especially type 1 patients, is the insulin pumps. Insulin pumps are like tiny, small devices which store insulin. You have to fill insulin into that. So this keeps on pumping the insulin. Small pump will be there with batteries. These devices are about the size of our Walkmans, which we used to have back in the day, or even half size of the Walkman, Sony Walkman we used to use while playing the MP3. Can be attached to your belt or the jeans, or it can be even kept in the pocket. So it comes with a wire. The wire continuously supplies the insulin underneath your skin. This does not require any surgery. It is just like a clip will attach to the abdomen, and from the insulin pump, the insulin gets pumped continuously. So these insulin pumps are a savior for several of our type 1 children who can afford them. Cost is definitely an issue in Indian scenario, but who can afford, they don't need multiple pricks a day. And it delivers the insulin in a precise manner, more continuous manner than taking the regular way of pricks. And here also, there were many advances which has happened in the recent years. Earlier, the older generation pumps used to do it manually. We have to set the amount of insulin that needs to be delivered by consulting with your doctor or with taking the help of these sensors we attach to the arm. We know how the sugars have been going through different parts of the day, and then we adjust the insulin rates. Let's say 12 to 12 p.m. to 3 p.m. 1 unit per hour, 3 p.m. to 6 p.m. 1.1 unit per hour, like that we used to determine. But now there is a new advance. There is one newer pump which automatically adjusts the insulin based on your sugars. So it's like an artificial pancreas. So Medtronic 780G system is available, and I think I am the one. I'm me along with Dr. Mohan. Sir is our chairman. Along with Mohan sir, I am the one who started in India. The first pump was started by Dr. Mohan sir and me. And till date, we have about a dozen patients who came from different countries also to come and get these pumps. Because not everybody will be able to have the technology. We form a multidisciplinary team. Me, my dietitian, my pharmacist, and the technical person from the company all form a group and then guide the patient. It is it's a different procedure to who suits that. But what this pump essentially does is, this pump decides the dose on its own. That's the beauty. If you wear it and you calibrate it properly in the first 48 hours, once it also comes with a sensor. You need to wear a sensor. The sensor tells the pump what is the current glucose level every 5 minutes, and the insulin pump adjusts the glucose level, insulin dose according to that value. That's the beauty of it. So effectively, when your sugars are going above the normal range, it increases the insulin by adjusting the microboluses. And then when your sugars are taking a dip and it's about to go to the lower, it suspends the insulin on its own. It's akin to our pancreas. Normal people will have pancreas, which detects the glucose levels in the blood and produces the insulin accordingly. So same function without the need of a surgery, this pump does. So, if you look at any other organ failure like liver failure or kidney failure or heart failure, a transplant needs to be done, a donor needs to be found, and then the surgery needs to be done. This organ needs to be, with the right technique, needs to be implanted thereby, and also the patient needs to be put on immunosuppressants so that our immune system doesn't reject these organs. Then only they will have a respite from that organ failure. Whereas in type 1 diabetics and in certain adult diabetes also, like 1.5 diabetes LADA patients, and type 2 patients who are requiring multiple doses of insulin and despite that not having good control, these insulin pumps are a real lifesaver. So these adjust the insulin on their own without the requirement of any surgery, and cost is even lesser compared to the other organ transplants. So let's say kidney transplant costs around 20 lakhs, liver transplant 40 to 60 lakhs depending upon where you do, and you get a match and there will be a waiting time. There won't be anything of that, and 780G pumps costs around, in comparison, 6 lakhs with running expenses of about 10 to 15,000 every month in view of the disposables that they use, the pipe, as well as the batteries and the insulin, and even the sensors. The sensor what we use for the pump needs to be changed once in 7 days. That's a different sensor that we use. So these changes, if you do, the patient can go on to live life which is near normal. That is the beauty. I have had kids who had difficulty getting HbA1c down below 9, even with insulin pumps, older generation. When I use this newer insulin pump, perfect 6.5. Time in range, what we call, what percentage of the time that the patient spent in a day, is it in range or above the range or below range? We call it time in range. The guidelines is to keep it around 70, but I had patients who achieved time in range of 100% with this pump. So basically, this pump will not allow your sugars to go high, irrespective of your insulin status. And only one thing what you need to do is, when you are taking a meal, you need to tell it that I'm going to take a meal. Give around roughly 4 units of insulin. It doesn't matter whether you actually require 6 or 8 or even 2 units. The rest of the adjustment this pump will do. So I have seen excellent results. We have had international patients also coming into our center in order to get these devices from other countries where they have not launched these systems. India, it's good that India is being seen as a primary market now, by the companies who launch these innovative products, starting from insulins, the newer medication, newer pills as well, which cause weight loss. all these things are, because we have such a huge group of patients, that is also one sad story. But things are definitely changing. I feel much comfortable practicing in this decade rather than 3 decades back. Or if you look at the start of this, 2000s, we had only sulfonylureas and metformin. Now we have a big armamentarium of newer drugs, especially DPP-4 inhibitors, SGLT2 inhibitors. New classes of drugs are being discovered in diabetes. I would say this is one of the only few areas in internal medicine where research is done in large quantity, in addition, apart from oncology. So in that way, we are very grateful that these companies, and especially our Madras Diabetes Research Foundation, which is spearheading research in India, is producing high quality research papers which are acknowledged throughout the world. And that definitely helps us take better decisions in a clinical scenario in order to have confidence which drug would fare better in our Indian population based on the large data that we acquire. So all in all, the technology coming to Indians first on par with the primary markets of US, Europe, and Canada is a big welcome change that we are which we are seeing in the last 1 decade, I would say. So these are all the newer technological advances. And coming to medicines, the newest medicines which are going to come, we have a new class called as GLP-1 receptor agonists. So these GLP-1 agonists are approved for weight loss alone, even in non-diabetic patients. So that's not yet available in India. Semaglutide is going to be available. Oral form of the semaglutide is available in India, but that's not for non-diabetics. So, but patients who are using this tablet are on average losing 7 to 8 kgs without having major side effects. Minor side effects like nausea, vomiting, diarrhea are common, but those who are able to tolerate it, and then when we go to the next level dose based on the patient's ability to tolerate it, they are having excellent response with this newer class of GLP-1. And in 2023, we are going to see next version of this GLP-1 called as tirzepatide, which is going to be launched as early as April 2023 is what I am expecting. So the results in US are showing that the patients have lost to the tune of 20 kilos. Of course, that depends on the baseline weight, baseline BMI, and several other factors. But these drugs are excellent in causing weight loss and thereby reversing remission, induces remission of diabetes in many of the patients. They don't need to take anything after that. And that again is a short-lived. It's not like permanent remission or cure for diabetes. As long as you are taking these medicines, the appetite will be less and the weight loss will occur, the fat loss will occur. And because of that, the amount of insulin produced by your pancreas will be utilized well by your body, and thereby prevents the high sugars, and diabetes will go into remission. But with once you stop the drugs, the appetite is back, weight gain is back, or natural degradation of with age itself, the cells which produce this insulin will undergo degradation. So because of that, diabetes progresses. So it comes to a point naturally when even after taking this medicine, the diabetes will be back. So then they need to be put on other medication which helps in control of your diabetes. So this is what we do, and we also use the latest of the technology like cloud telephony, wherein multiple calls can get answered in an effective manner, and also our new app wherein they can patients can directly book the appointments, download the labs, or even in the future we have plans to generate our consultation summary and medication prescription to them, and patients can order on the app itself directly. So all these features are coming, and every day, these technological advances are making our practice very easier, and thereby benefiting our patients as well in terms of adhering to the follow-up. Because important in diabetes is not to control your sugars, and maintaining that control is very important for as long as possible. That is the only way which has been proven to reduce the complications of diabetes. So with that, I would like to stop talking about this, and I'll take some questions from the chat. Yeah. Okay, Mr. Banayakam, good evening, doctor. Yeah, Mr. Sukumar Gurmurthy, I'm 72-year-old diabetic patient, insulin dependent. Recently, I had CGM monitoring for 14 days. Since I am taking Mixture 30/70 in the morning and injection Tresiba Diglutec 20 units, I had hypoglycemia almost daily in the early morning between 3 to 5. So how to proceed? So yes, in your elderly patients, hypoglycemia is very problematic. So we definitely, an elderly patient who is taking insulin, especially twice daily, comes to our clinic, we always pay attention and ask for more details as to what is the pattern of the sugars that is going through. And the CGM pattern needs to be analyzed. There may be something called a Somogby effect, where in nighttime sugars may be actually going more, that causes a dip in the morning sugars that we need to rule out. And if it is actually not because of Somogby, then it is possible that your degludec, which you are taking Tresiba, which works for more than 24 hours, is maybe the reason behind this, drop during the 3 to 5 a.m. It is very dangerous because in night time, when low sugar happens, you will not get the normal symptoms that you would be getting, especially in elderly group, because the nerves will be blunted. They will not be able to convey the symptoms that increased hunger, sweating, and giddiness. Those symptoms may not be there, so it's difficult to identify, and that can be life-threatening. I suggest you to please consult any of our clinics nearby. Mohan's Diabetes has 51 branches, so it depends on where you are. You're just one phone call away from us, and you can definitely, we need to look at that in a case-to-case basis, and then if needed, reduce the dose of the degludec, that is Tresiba. So, my previous HbA1c was 8.3 before, but now average was 5.8 during this 14 days. Yes, that is the cause. Your HbA1c, you are over insulinizing. Yeah? So you need to reduce your insulin. Degludec dose may be, as an emergency measure, you can reduce it by 4 units and monitor your sugars and then reduce it further if the morning sugar is not picking up, is what would be my advice. But again, a long-term approach needs to be decided by discussing with your healthcare provider. I hope to have answered your question, Mr. Sukumar. Ms. Malati Ravindran, could you please elaborate on artificial pancreas? Yes, artificial pancreas system is what I was telling all these days. There is nothing like artificial pancreas. Human body is so complex. We cannot make a duplicate for our organs yet. So maybe in the next 100 years, we won't be able to do that. So artificial pancreas systems. So what it does is, it essentially dispenses insulin according to as is done by your pancreas naturally. So in pancreas, what is the organ? Pancreas is present behind our stomach. Whenever your blood glucose levels go, it has a sensor on its surface, what we call sodium potassium ATPase channel. That channel recognizes the excess glucose, and then it produces the insulin according to the glucose level. So when your glucose levels go up after a meal, from your meal, the glucose production also increases. So all the principles that we are using insulin from outside, the injection, mixtard, and glucose, basically is to mimic the natural action of the pancreas. When body needs more insulin, we need to deliver more insulin. When body needs only basal insulin, we need to give only basal insulin. That is the principle with which we treat the patients with insulin. But with the advent of artificial pancreas system, APS, what they call, these are insulin pumps who take these decisions every few seconds or every few minutes, I would say, based on the blood glucose value coming from the sensor, and then it will take the decision as to how much insulin needs to be dispensed by itself without the human interference. So artificial intelligence is used in these machines, wherein the machine learns. After working for some days, it will figure out this is the best way, then it will learn from that and then improvise by itself. So these are the, I think the first and only APS system what we have, artificial pancreas system, is 780G for now, but many more yet to come in India. In other countries, we have other systems also, Omnipod and Dexcom C8 and other, even patients who used to hack their old insulin pumps in order to get them to work. So, but that's very technically challenging and it's not FDA approved. But the one insulin pump which works out of the box in India right now at this moment is Medtronic 780G system, which is the one which can be labeled as artificial pancreas system. And I have seen the results. They are wonderful, groundbreaking and revolutionary changes to our type 1 diabetics. 100% time in range is not something, it's humanly possible. No matter how many times you prick and adjust your insulin, 100% time in range is not possible in type 1 diabetics, majority of them at least. I can't say for everybody, but I'm very excited that it is happening in some of my patients who are using that 780G pump at least. So, Ms. Nitika Sharma suggests some tips for diabetes during festival days, doctor. Yes, very, very important question. So one thing, what we notice in Bangalore every year in October is that there is a drop of patients. Why? Because everybody is in festival mode and they go to the native and thereby neglecting the instructions that we are given in July. So they would have come for July. After that, we suggest to follow up every 3 months because the test what we do HbA1c has a limitation. It can tell our sugar control only for the last 3 months only. That's the reason why we ask you to come for every 3 months. And when you check these sugars later, if your sugars are found to be high, we cannot do anything about what has already happened. That means your body was taking some damage. So definitely once in 3 months, please, wherever you are, whoever you are diabetic, please keep a check. HbA1c is widely available now. Very cheap. They are doing it even in camps organized by some of the NGOs, or even Mohan's there's a lot of camps where they do the HbA1c. So in that, if you can identify your HbA1c is below 7, then reasonably you can delay your, say you're reasonably good to say that your sugars are under control. But again, other factors, controlling sugar alone is not enough. Getting your blood pressure checked whenever you go to the doctor, identifying when the hypertension starts, getting your cholesterol below 100, and taking vaccines, very, very important vaccines. We have seen and learned that, in India, that COVID vaccine, whoever have taken it have avoided the complications altogether during last year. That was my learning, at least. So we need to apply the same learning to the number 2 killer in humans, that is influenza. Influenza also strikes during the winter time. In fact, yesterday itself, US CDC has suggested, in news it came that, this year flu season is going to be stronger everywhere, and it suggested a caution. What caution? Need to take flu vaccine every year before the winter starts, as all the developed countries have been doing for 80 years. Indians are slow to adapt that. That awareness is not there among the general public. The stakeholders, governments, and NGOs do not, necessarily tell that. And even, doctors don't have time to talk to their patients and tell the importance of these prophylactic aspects or preventive aspects. So important to take your flu shot every year before the winter season starts. I do that, and I do it for all my family members. So very important to do that. So it is a common practice in Western countries, or even Australia, Hong Kong, Vietnam. All the population are vaccinated for flu, because that is the second deadliest virus after COVID-19. And we have seen with COVID-19, none of the medicines or healthcare, none of the medicines will work for it once you acquire it. It is the vaccine which makes it like a milder disease, and thereby reduces the complication when you talk at a country level. So yeah, so when you are in, mainly during the festival days, it's important not to miss your follow-ups, and of course have moderation with respect to the carbs. Indians love to eat carbs. 60 to 70% during festival season, almost 90 to 100%. So reduction in the carbohydrates, because your bodies cannot metabolize these carbohydrates. That's the reason your sugars go high, and thereby causing toxicity and damage to all the other organs, blood vessels, nerves, cells, eyes, kidney, everything gets damaged because of this slow poison called as glucose, which is coming from carbohydrates. So avoid anything made up of rice, wheat, and purified sugars in excess quantities. When eating your food in moderation is the key. And of course, exercise routine goes for a toss during the holidays. So it's important to incorporate a routine for your exercise depending upon your fitness level and age, and continue the same during the festival as well. That's my suggestion. And Ms. Soundarya Nair, good evening, doctor. Very informative about recent advances. Number 1, do vitamin D improve glycemic control and insulin sensitivity? Role of vitamin B12 in long type 2 diabetes. Yes, a very important test we do routinely. Vitamin D is not per se, of course, there are some anecdotal studies saying that, it is linked to poor control of HbA1c. But in clinically, or what we can perceive in clinical practice, we cannot say so. But with that said, vitamin D deficiency is a universal phenomena. Humans are not nearly getting the vitamin D in the required quantities. Even when you look at studies done 100 years back, we have very less vitamin D. So many of you may not be aware this. Your milk coming to your house, your oil, any oil you purchase, government, it made mandatory that vitamin D needs to be added to them, fortified. They must be fortified with vitamin D in order to improve the vitamin D levels of the society. So in that tone, if you are identified to have vitamin D deficiency, it's better to correct it, whether it may have impact on your diabetes or not. But there are some studies which showed there is a indirect connection with respect to your immunity as well as diabetes control with respect to vitamin D deficiency. And same thing, role of vitamin B12 in type 2 diabetes. Some of the complications of diabetes, especially neuropathy, which occurs very commonly when you have diabetes for 8 to 10 years, that is, those symptoms are very common in patients with vitamin B12 deficiency. The symptoms are same. It causes the tingling, numbness, and pain of the lower extremities, and that you will improve with when you supplement your vitamin B12. And also some of the medicines that we use, if used in excessive and large quantities, can lead to vitamin B12 deficiency. It's a good idea when you're a diabetic, at least once in a year, whether it's irrespective of whether you're a non-vegetarian or vegetarian, please check your vitamin B12 and correct it. One less problem to worry about. So, so that we can focus on managing the diabetes and other, comorbidities that you have in a better manner. So vitamin D and vitamin B12 are very easy to correct. So get your levels tested, and if it's found to be low, taking simple once a weekly pill will correct that problem. So vitamin D and vitamin B12 definitely needs a judicious approach depending upon whether the patient is a vegetarian or non-vegetarian, and either pills or injections will help in control and in replacing those vitamin B12s to the normal range. Any other questions? Let's wait for a couple of minutes. I think I have come to the end of the question and answers here in the chat box. If you have any other questions, please post them here, so I will answer to the best of my ability. Okay, there's no more questions. So yeah, I'd like to wind this session now. So if you have any more questions, you have our number, the call center number going on. You can reach us to any of our doctors. We are here every day, irrespective of whether a cloud burst or a lockdown. The doctors are here for your service. Please utilize that. Manage your diabetes and hypertension and thyroid better, and that leads to a long life. Thank you very much. Take care.